Ever find yourself maybe squinting a bit more at restaurant menus lately? Or perhaps those oncoming headlights at night seem, I don't know, way too bright, almost like a starburst.
Yeah, or maybe just threading a needle feels harder than it used to.
Exactly. These little changes in vision, well, they're super common as we get older. And today, we're going to zoom in on one really, really frequent reason for this: cataracts.
That's right. A good way to think about it is like the lens in your camera. It needs to be clear, right,
Hmm.
to focus the light.
Okay.
A cataract is basically when that lens, the natural one inside your eye, starts getting cloudy, like a window steaming up.
Uh-huh.
And that makes everything less sharp.
Right, like trying to see through mist. And this isn't just a minor thing for a few people. The info we looked at suggests it's, well, pretty widespread.
Oh, absolutely. It's huge. Cataracts are actually the leading cause of blindness worldwide.
Wow. Number one.
Number one. So understanding what they are, how they happen and what the options are is really valuable stuff. Whether maybe you're noticing changes yourself, or perhaps a family member is, or even if you're just curious about eye health.
Okay, so that's our mission for this deep dive, to give you a really clear, high-yield understanding of cataracts. We've sifted through a comprehensive overview, pulled out the key info,
Yep, we'll cover the definition, what causes them, the risks, how they actually affect your sight.
how they're diagnosed, treatment, what happens afterwards, and we'll throw in some memory tips too, hopefully make it stick.
Sounds good.
So let's dive in. Definition first. What exactly is a cataract?
Okay, so simply put, it's a clouding of the eye's natural lens. Now, this isn't something like on the surface. It's inside the lens.
Inside, okay.
And as that lens gets cloudier and cloudier, think of it like clear glass slowly turning frosted, less light, actually gets through to the retina at the back of your eye.
Ah, so that reduction in light is the key to the blurry vision.
That's it. It leads to that blurry, hazy picture, like taking a photo through a dirty camera lens, basically. It's a progressive opacification.
Progressive, meaning it tends to get worse over time if you don't do anything.
Exactly. It's a gradual thing, this loss of transparency. And like we said, that makes it a massive global health issue, leading cause of blindness.
Right.
And interestingly, doctors classify them in different ways, often based on where the clouding is in the lens.
Okay.
So you might hear about nuclear cataracts. It's often age-related, right in the center, makes reading harder. Then there are polar ones, often inherited, at the front or back poles of the lens. Subcapsular, they're at the back surface, sometimes linked to steroid issues.
Steroids again.
Yeah, and dot opacities, little spots, can be normal or seen in things like diabetes or myotonic dystrophy.
So different types based on location. And you can also classify them by when they show up.
Yes, absolutely, by onset.
Yeah.
So presenile, if they develop earlier, and senile for the age-related ones. And those senile age-related ones are by far the most common type.
Gotcha. And when someone gets diagnosed, what are they typically noticing?
Usually it's reduced visual acuity, that's just the sharpness of vision, like on the eye chart.
Right.
They might also complain about glare, finding bright lights really bothersome, or seeing halos around lights, especially at night.
The halos, yeah.
And one really crucial point to congenital cataracts. Those are ones babies are born with. It's vital to catch and treat those early.
Why is that?
Because if they're not treated quickly, they can lead to permanent, irreversible vision problems, amblyopia or lazy eye.
That makes sense. Treat early. Okay, so we know what they are, the types. What actually causes the lens to get cloudy like that? The etiology?
Well, the biggest factor, as we kind of hinted, is just getting older, aging.
Wear and tear.
Pretty much. Over time, the proteins that make up the lens, normally they're arranged really neatly to stay clear. They start to break down, denature, and clump together.
Like tangled threads.
Exactly. They form these opaque clumps. But age isn't the only culprit. Genetics definitely plays a part.
So family history matters.
It can, yes. Also, trauma, getting hit in the eye, can sometimes set off a cataracts later. Certain medications are a big one, especially corticosteroids used long-term.
Right, we mentioned those. Systemic ones?
Systemic ones, yes. And also some systemic diseases themselves, particularly diabetes. Diabetes is a significant risk factor.
Okay. What about things like lifestyle or environment?
Big ones. There are UV, radiation, ultraviolet light from the sun. Years and years of exposure can damage those lens proteins.
So sunglasses are important then.
Definitely. And smoking, too. That's consistently linked to a higher risk of developing cataract.
Okay, smoking affects the eyes too.
It does. And if you look globally, especially in developing parts of the world, other things come into play more strongly. Malnutrition, severe dehydrating illnesses, and just generally more intense, unprotected UV exposure.
Right, so aging's the main one, but sun protection, managing health conditions like diabetes, not smoking, those seem important too.
Absolutely.
Which leads nicely into the specific risk factors. Who is most likely to get cataracts?
Okay, so the key ones to really nail down are, number one, advanced age. That's the biggie.
Yeah.
Then family history, your genetics,
Yeah.
medical conditions, especially diabetes,
Diabetes?
prolonged sunlight or UV exposure,
S sun.
and smoking.
S smoking. So AFMSS, age, family history, medical conditions, sunlight, smoking.
Exactly. That mnemonic, AFMSS, can help you lock those key ones in.
That's useful. Are there others beyond those main 5?
Yeah, definitely. We've mentioned systemic corticosteroids multiple times. That's a known risk. Other meds can play a role too.
Okay.
Eye trauma, we touched on that. Also inflammation inside the eye, something called uveitis.
Uveitis, right.
Poor nutrition in general. Lower socioeconomic status can be a factor, often linked to diet and healthcare access, exposure to certain toxins, other metabolic disorders, and more specific genetic syndromes.
Lots of contributing factors then. You mentioned systemic steroids, but what about like steroid eye drops or inhalers?
Yeah, that's a good question. The link with topical, like eye drops or inhaled steroids, isn't quite as clearly established as it is for the systemic one.
Interesting. So a pretty long list of risks. Let's get into the nitty-gritty. How does this clouding actually happen, the pathophysiology?
So the basic mechanism, as we said, is those lens proteins clumping up. They lose their normal, highly organized structure that keeps the lens clear, and they aggregate, forming these opaque areas that scatter or block light.
Right, stopping the light getting through cleanly.
Exactly. Now, the precise molecular triggers, well, they're complex and honestly not fully understood for all types.
Still some mystery there.
A fair bit. But for the common acquired cataracts, the age-related ones, oxidative damage seems to be a really important factor.
Oxidative damage, like rust.
Kind of, yeah. It's damage from unstable molecules, free radicals accumulating over time. They can damage the proteins and lipids in the lens.
So people talk about antioxidants. Does eating blueberries help prevent cataracts?
Well, while antioxidants are generally good for you, the evidence that specifically eating an antioxidant-rich diet prevents cataracts isn't really strong or definitive, according to our sources.
Okay, so no magic bullet there, unfortunately.
Not proven, no. Another interesting thing about the lens is that it keeps growing throughout your life. New lens fibers are laid down on the outside, but the older ones in the center aren't removed.
Oh, it gets denser.
Exactly. It gets denser and less flexible just naturally with age. Its transparency relies on that very precise structure, and its chemical makeup, high concentration of specific proteins, low water content compared to other tissues.
Makes sense.
And also with age, pigments can gradually build up in the lens nucleus. This can affect color vision, making things look a bit yellowish, and reduce contrast sensitivity.
So that explains why colors might seem faded. Okay, so if someone comes in with blurry vision, it might not be cataracts. How do doctors figure it out? What's the differential diagnosis?
That's a really crucial point. You absolutely have to consider other causes of gradual vision loss. The most common thing is often just a refractive error, needing new glasses or contacts, myopia, hyperopia, astigmatism.
Right, just needing a new prescription.
Exactly. Then there are more serious conditions like age-related macular degeneration or AMD, which affects the central part of the retina. Glaucoma is another big one that damages the optic nerve, often causing peripheral vision loss first.
Okay.
And then there are various other problems that could affect the retina itself or the optic nerve, like diabetic retinopathy or optic neuropathy. So a thorough eye exam is absolutely key to distinguish cataracts from these other possibilities.
Got it. You need to rule out the other stuff. So let's talk numbers. How common are cataracts? Epidemiology time.
They are extremely common, especially as people get older. Here in the UK, the data suggests more than 50% of people aged 65 and over have some degree of cataract formation.
Wow, over half.
Yeah. And the older you get, the more common it becomes. We also see it slightly more often in women than in men, generally. Overall, about 30% of folks aged 65 plus have cataracts that are actually impairing their vision significantly enough to cause problems.
30% with vision problems from it. Do we have breakdowns by age group in the UK?
Yes, the numbers show a clear trend. For younger adults, say 20 to 39, it's pretty low, around 3%.
Okay.
Jumps up quite a bit in the 40 to 59 age group to nearly 17%.
17%. Okay.
And then over 60, it really takes off over 54%. And a specific UK study looking just at the 65 plus group found for those 65, 69, it was about 16% with visually impairing cataracts.
16.
But that rose to 24% for 70, 74-year-olds.
Okay.
0.42% for 75, 79.
42.
0.59% for 80, 84.
Wow.
And a huge 71% for those 85 and older.
71%. That really drives home the age link.
It really does.
Yeah.
And just to reiterate, cataracts are generally rare in children.
Right. And the global picture.
As we mentioned, globally, it's the leading cause of sight loss. Just think, out of around 36 million people blind worldwide, cataracts account for over 12 million of those cases.
12 million. That's staggering.
It really highlights the global burden, especially in areas with less access to surgery.
Absolutely. Okay, so what does it actually feel like? What are the typical signs and symptoms someone with cataracts might notice? The clinical features.
Usually it's a gradual thing. The most common symptom is blurred or hazy vision, like you said, looking through fog or a dirty window.
Okay, blurry vision.
Increased sensitivity to glare is another big one. Bright sunlight or oncoming headlights can be really uncomfortable, dazzling.
Yeah, the glare.
Difficulty seeing, well, in dim light conditions, like trying to read in a poorly lit room. Some people notice that colors seem faded or yellowish, less vibrant than they used to be.
Loss of color perception.
Exactly. And occasionally, maybe seeing double in just one eye. That's called monocular diplopia.
Double in one eye. Okay.
Frequent changes in your glasses or contact lens prescription can also be a sign that a cataract is developing and changing the eye's focus.
Needing new glasses all the time.
Yeah. And those halos around lights we talked about, especially at night.
Right. So maybe a mnemonic for those, like BGDLCD8?
Yeah, that could work. Blurred vision, glare sensitivity, difficulty in low light, loss of color perception, change in prescription frequently, double vision, monocular, and halos, BGDLCDH.
BGLCDH. Handy. Do the symptoms change depending on which type of cataract it is?
Yes, they can vary a bit. So nuclear sclerosis, the one in the center, often causes more trouble with contrast and seeing fine detail, maybe more difficulty with near vision initially.
Okay.
Cortical cataracts, the spoke-like ones in the outer layers, they tend to scatter light more, causing significant glare. Reading can be tough.
Glare from cortical.
And posterior subcapsular cataracts, right at the back surface of the lens, they often cause major issues with glare and reading, especially in bright light. Interestingly, vision might sometimes seem a bit better in dimmer light with this type.
Oh, that's counterintuitive.
It is a bit. And just briefly on pediatric cataracts, whether congenital or developing later, they can have various causes. Sometimes infections during pregnancy, like rubella, or metabolic disorders or genetic factors.
Right. And what might an examiner see?
During the exam, besides the cloudy lens itself, you might see defects in the red reflex, that red glow you see in photos sometimes, or even just a change in the lens color, like it looking grayish or yellowish in bright light. Standard tests always include visual acuity, checking pupil reactions, and making sure the person can locate a light source.
Okay. So if someone has these symptoms, goes to the optician or ophthalmologist, what tests are done to confirm it? The investigations.
The cornerstone is a comprehensive eye exam. That's really how it's diagnosed.
The eye exam.
Yep. It includes a few key parts. First, testing the visual acuity, the eye chart test, basically. Then, very importantly, the slit lamp examination. The doctor uses a special microscope with a bright, narrow beam of light, the slit lamp, to get a highly magnified view of the front parts of the eye, including the lens. That's where they can directly see the cataract, assess its type and density.
You can actually see the cloudiness.
Exactly. And then usually a dilated eye exam. They put drops in to make your pupils wider.
Why do they do that?
That gives them a much clearer view of the back of the eye, the retina, and the optic nerve. This is crucial to rule out those other conditions we talked about, like macular degeneration or glaucoma. That could also be causing vision problems.
Makes sense. Check the whole eye.
Right. And interestingly, with just cataracts, the view of the fundus, back of the eye, is usually normal, assuming the cataract isn't too dense to see through. The main finding is the cataract itself on the slit lamp.
Okay. Any other tests sometimes?
Occasionally, if the cataract is very dense and blocks the view, they might use other tests like an OCT scan, optical coherence tomography, which gives cross-sectional images, or even an ultrasound B scan to check the structures of the back of the eye. But usually, the standard exam is enough.
So slit lamp and dilated exam are key. And once it's confirmed, what's the plan? How are cataracts managed?
Well, the primary management, and really the only definitive cure, is surgery.
Surgery.
Yep. Cataract surgery is one of the most common and successful surgical procedures performed worldwide. It involves removing the cloudy natural lens
Taking the old one out.
and replacing it with a clear artificial lens. That artificial lens is called an intraocular lens, or IOL.
IOL. Okay. Is surgery the only option? What about if it's just starting?
Good question. In the very early stages, when the vision changes are still mild, surgery might not be needed right away. Some non-surgical things can help manage symptoms for a while.
Like what?
Things like updating your glasses or contact lens prescription to get the sharpest vision possible, using brighter lighting for reading and close tasks, maybe using a magnifying glass. Anti-glare coatings on glasses can help a bit too.
So coping strategies, basically.
Exactly. But it's really important for people to understand these measures don't slow down or stop the cataract from getting worse. They just help you function better temporarily.
Right. They don't fix the underlying problem.
Precisely. Eventually, as the cataract progresses and starts to significantly interfere with vision and daily activities, things like reading, driving, watching TV, recognizing faces surgery becomes the recommended option.
And how is that decision made? Is there like a vision level where you have to have surgery?
Not really a strict cutoff based purely on the vision chart. The referral criteria are more based on the degree of visual impairment, how much it's impacting the person's quality of life, their daily needs, and, of course, the patient's own choice after discussing the risks and benefits.
So it's a personal discussion?
Very much so. It's vital patients are informed about the different types of IOLs available to, as they can correct different vision problems. Post-op care involves eye drops, usually for a few weeks, maybe wearing a protective shield, and follow-up appointments.
And it works well, usually.
Oh yeah, success rates are very high. Around 85–90% of people achieve driving standard vision or better, like 612 corrected vision after surgery. There's currently no proven medical treatment, no drops or pills that can prevent or reverse cataracts. Surgery is it.
Surgery is the fix.
It's the only effective way to restore or maintain vision affected by cataracts. The most common technique today is called phacoemulsification.
Phacoemulsification.
Yeah, often just called phyco. It uses ultrasound waves to break up the cloudy lens into tiny pieces, which are then suctioned out through a very small incision.
Ah, ultrasound. Less invasive.
Much less invasive than older techniques. The small incision often doesn't even need stitches and heals faster than the foldable IOL is inserted through the same small opening.
Okay. And you mentioned challenges in the developing world.
Yes, big challenges remain there regarding awareness of the condition, access to affordable eye care, and just the sheer number of trained surgeons needed to tackle the backlog.
Right. So deciding on surgery, it's not just about reading the chart. It's about life impact, risks, benefits, alternatives, whether one or both eyes are affected.
Absolutely. Access isn't or shouldn't be solely based on visual acuity numbers. It's a holistic decision.
Yeah.
The older technique, intracapsular extraction, where the whole lens and capsule were removed, is rarely done now due to higher complication risks. Extracapsular techniques, especially phaco, are the standard.
Okay, that makes sense. So after the surgery, what's the typical outcome? The prognosis.
Generally, the prognosis after cataract surgery is excellent. Most people experience a significant improvement in their vision and quality of life.
That's great news.
It really is. Of course, the final outcome depends a bit on the overall health of the eye. If someone has another underlying eye condition, like advanced glaucoma or macular degeneration, their vision might still be limited even after perfect cataract surgery.
Right, it can only fix the cataract part.
Exactly. But for age-related cataracts in an otherwise healthy eye, as we said, something like 95% of patients achieve 612 vision or better.
Fantastic.
Though it's worth noting, subjective outcomes can vary. And depending on the type of IOL chosen, many people might still need glasses for certain distances, often for reading, even if their distance vision is clear.
Okay, still might need reading glasses. What about kids?
The prognosis for children is more complex. Untreated cataracts in kids under 10, especially if dense and present from birth, can lead to permanent visual impairment, like amblyopia. Even with treatment, bilateral cataracts often result in only partial sight. Early intervention is key.
So crucial for kids. And driving.
Yeah, driving is a big quality of life factor. Significant cataracts can definitely affect driving ability due to reduced vision or glare. After surgery, most people meet the driving standard, but sometimes restrictions might apply, and assessment by the licensing authority, like the DVLA in the UK, might be needed.
Important considerations. Now, no surgery is completely risk-free. What are the potential complications?
That's true. While cataract surgery is very safe overall, Complications can happen, although thankfully they're rare and usually manageable.
Okay. What kind of things? Early on.
In the immediate post-op period, maybe the first few days or weeks, potential issues, maybe affecting 1–3%, could include things like a tear in the posterior capsule, the thin membrane behind the lens. Sometimes issues with sutures if they were used, or a bit of trauma to the iris.
Okay.
A very rare but serious complication is endophthalmitis. That's a severe infection inside the eye. Extremely uncommon now with modern sterile techniques, but devastating if it happens.
Infection sounds scary. What about later on?
Later complications can occur weeks, months, or even years down the line.
Mm-hmm.
The most common one by far is posterior capsule opacification, or PCO.
PCO. What's that?
That's when the thin capsular bag that holds the artificial lens becomes cloudy over time. It can feel like the cataract is coming back with blurry vision returning.
Oh, no. Does it need more surgery?
Thankfully, no. PCO is actually pretty common, maybe affecting up to 40% of people eventually. But it's usually easily treated with a quick, painless outpatient laser procedure called a Y-gay capsulotomy, which creates a clear opening in the cloudy capsule.
Ah, a laser fix. That's good.
Yeah, very effective. Other less common late complications can include cystoid macular edema, which is swelling in the central retina, uveitis, which is inflammation inside the eye, retinal detachment, which is serious, development or worsening of glaucoma, and some other rare issues.
Okay.
Some people might also experience persistent visual disturbances like dysphotopsias, unwanted glare, halos or starbursts around lights, even with a clear lens implant.
Those halos again?
Yeah, sometimes they persist.
Sure.
Certain patient factors can increase the risk of complications, and if vision is poor after surgery, it might be due to the artificial lens power not being quite right, or an undetected pre-existing eye condition, or one of those surgical complications like the posterior capsule rupturing during surgery, and maybe some vitreous gel being lost.
So a range of possibilities, mostly rare or treatable.
Exactly. Overall, it's a very safe and effective procedure, but it's important to be aware of the potential, albeit small, risks.
Absolutely. Well, this has been incredibly thorough. Thank you. So, just to quickly wrap up the key takeaway, cataracts, super common with age, cause vision loss because the lens gets cloudy.
But the really positive message is that surgery to replace that cloudy lens with an artificial one is generally very safe and highly effective in restoring vision for most people.
Definitely. And the crucial advice is, if you notice any changes in your vision, blurriness, glare, faded colors, don't just put it down to getting older. Get your eyes checked by an optometrist or ophthalmologist.
Couldn't agree more. Early detection and discussion of options are key.
And for anyone listening who wants to dive deeper or is maybe revising for medical exams like the MSRA, do check out passthemsra.com. There's also freemsra.com for, well, free resources.
Great resources. Passthemsra.com and freemsra.com.
And maybe a final thought to leave you with, thinking about how far cataract surgery has come, with tiny incisions and sophisticated artificial lenses.
Yeah, it's amazing. It really makes you wonder what the next breakthroughs might be. Maybe lenses that adjust focus automatically, or even ways to prevent cataracts from forming in the first place. Lots of exciting possibilities down the road.